Good morning, everyone. I'm Vicki Collie-Akers. I'm faculty at KU Med Center in the Department of Population Health. I'm an associate professor there, and I'm also the Kansas Health Foundation Professor of Public Health Practice. I'll be talking a little bit about our partnerships with local health departments that we call academic health departments. Next slide. I will start by just providing really brief background about what we mean by academic health departments, and then describe a longstanding partnership with Lawrence Douglas County Public Health. Next slide. Next slide, please. Thank you. So in public health, we use the 10 essential public health services to serve as our North Star to understand whether or not we're fulfilling optimal public health in different communities. As you look across these different services, you'll see that they run the gamut from assessment to policy development to assurance. And there are certainly places where academia makes a unique contribution. For example, essential service number 9 is improve and innovate through evaluation, research, and quality improvement. However, if these essential services only stay within academia, we have a short-sighted approach and will not achieve the impact of creating healthier, more equitable communities. Next slide. So that raises an important and persistent challenge that's been acknowledged really since the 1980s, that there are not deep partnerships between governmental public health and academia. And that really precludes the development of applied research opportunities. It inhibits the uptake of evidence-based practices and doesn't provide opportunities to allow for engagement in collaborative public health practice. Out of acknowledging that persistent challenge arose the idea of academic health departments. Next slide, please. Academic health departments are defined as a formal affiliation between health professions, a health profession school, and a local health department. Although they've been in existence for about 30 years, there's not a prescriptive model. And when you look across the 70 academic health departments in the United States, there's extreme variability in what they do. Next slide, please. In 2011, Lawrence Douglas County Health Department, which is now Lawrence Douglas County Public Health, was embarking on a path towards accreditation, and they reached out to KU to help with some of the prerequisites for accreditation, including a community health assessment and improvement plan. As part of the assessment, we looked at the 10 essential services and the extent to which they were being performed optimally in Lawrence and Douglas County, and really found that the poorest grades that we had were around those places that academia could make a unique impact. So because of that, we developed the first academic health department in the state of Kansas. Next slide, please. In 2013, we established an MOU that consisted of partnership principles and an outline of particular activities. It included a contract for shared personnel, as well as space for faculty and students to study and learn together. That initially started with the KU Center for Community Health and Development, and in 2019 expanded to include the KU Department of Population Health. Next slide. Our academic health department seeks to advance population health in Douglas County by driving policy, system, and environmental change, contributing to the evidence base of what works in public health, and building the capacity of the current and future workforce. On this next slide, you will see our accomplishments in these 3 buckets. Next slide, please. So around driving policy and system and environmental change, we've done a lot of work around a community health plan. We helped the health department complete an equity assessment around living wages and help them pass a living wage floor for their employees. And we've completed white papers on different topics like behavioral health and childcare. We've evaluated specific programs, and then we've also engaged health department staff in completing KU coursework. More than 60 students have completed their internships at the health department, and we walked the health department staff through an 8-month training session built around building staff capacity as chief health strategists. Next slide, please. This slide displays a more expansive view of our accomplishments through the academic health department, but also in a language that maybe is better understood from the academic center. That's one of our deep lessons learned, is that you have to talk both languages, both the public health practitioner language as well as the academic language. Next slide. Next slide, please. We have developed, oops, sorry, back one. I'm so sorry, Valerie. Thank you for your help. we have developed some critical lessons learned from this work that I think speak to the anatomy of partnerships. We developed early on a collaborative MOU that provides a broad framework for our efforts, and then we complete an annual work plan that provides structure to those broad principles. We really have centered relationship development as part of this work, and it's been really critical for understanding each other's interests and the interests of the institutes behind us. And then I'll just say also related to relationship development, presence has been key. So we do have shared office space. I office there 1 day a week, usually not during pandemic times as it ends up, but mostly 1 day a week. And then we also have standing meetings that support integration. Next slide. I'll close by just noting a few community challenges and strengths. Communicating the value and benefit of the academic health department to stakeholders within both the academic institute and local health departments is an ongoing challenge and one we strive to meet. I spoke about different languages, but different benefits are relevant to the different stakeholders, so we work to make sure there's mutual benefit. We do think that the academic health department has created co-learning across partners. And then another strength really has been stretching the touch of public health. And I think our work on childcare really acknowledges that. Statutorily, local health departments work on regulating childcare settings. And as a health department, we're moving past just regulation to changing the environment around childcare. So our white paper that we produced talked about the costs that families in Douglas County experience, which you see on the right side of the slide, which led to the adoption of a policy agenda recommendation to include advancing universal pre-K in Douglas County as one of the policy agenda items for Lawrence Douglas County. And our work on the academic health department will seek to continue and expand that. Last slide, please.
We're about at time, Vicki.
Okay. Thank you. I'll just say we hope to expand our work and would invite anybody who's interested in learning with us to reach out for more information. Thank you.